Chapter 9: The Conquest of Infectious Diseases Source. Introduction to Public Health by Mary-Jane Schneider, 5th ed., 2021, Jones and Bartlett Learning. At one point in history, infectious diseases were the leading cause of death worldwide, plagues, fevers, and epidemics that devastated cities and shaped history. Today, many of those diseases are under control or even eliminated thanks to public health. In this video, we'll explore how infectious diseases were conquered, how they're transmitted, and what tools public health continues to use to prevent their return. Infectious diseases in the past before the 20th century, diseases like tuberculosis, smallpox, cholera, typhoid, and measles were constant threats. The Black Death in the 14th century wiped out up to 75% of Europe and Asia's population. Tuberculosis was the top killer in 19th century England. So what changed? By the 1960s, death rates from infectious diseases had dropped dramatically thanks to clean water and sewage disposal, milk pasteurization, better nutrition and hygiene, vaccines and antibiotics. It was a public health revolution, and many believed infectious diseases were a thing of the past. Infectious agents and how they spread. Most infectious diseases are caused by bacteria, viruses, or parasites. Bacteria like tuberculosis, diphtheria, and typhoid can live outside the body and multiply. Viruses like measles, polio, and AIDS hijack our cells to reproduce. Parasites like malaria and roundworms infect through food, water, or insects. These agents spread through aerosols from coughs or sneezes, contaminated water or food, direct contact or sex transmission, insects like mosquitoes, and sometimes through asymptomatic carriers like the infamous typhoid Mary. The chain of infection. To understand and interrupt disease transmission, we use the chain of infection. It has four main links. 1. Pathogen, the disease-causing agent. 2. Reservoir, where the pathogen lives. 3. Method of transmission, how the agent moves from one host to another. 4. Susceptible host, a person who can get infected. Public health efforts target these links, kill the pathogen with antibiotics, eliminate reservoirs, prevent transmission through hand washing, quarantine, or condoms, increase host resistance through immunization. The goal? Break the chain and stop disease in its tracks. Surveillance, quarantine, and contact tracing. Classic public health tools like surveillance and quarantine are still critical. When SARS emerged in 2003, lab tests couldn't diagnose it quickly, but health workers stopped the virus using old-school tactics. Isolate patients, trace and quarantine contacts. Interrupt transmission through public awareness. Surveillance is the front line. Once a case is spotted, public health workers trace contacts, test or treat them, and contain the spread. These same tools, along with newer technologies, were used during the early stages of COVID-19. Rabies. A model for local control. Rabies is nearly 100% fatal once symptoms appear, but it's also almost completely preventable. In the US, we control rabies by vaccinating dogs and cats, monitoring wildlife reservoirs, testing animals involved in bites, providing post-exposure vaccination for humans. Every bite is investigated. If the animal shows symptoms or can't be tested, the person is treated, just in case, because there's no second chance with rabies. Eradication, smallpox, polio, and measles. Can we eliminate diseases forever? Yes, if there's no non-human reservoir and an effective vaccine. Smallpox was eradicated globally in 1977. The last US case was in 1949. Polio is nearly gone, with only a few endemic countries remaining. Measles was eliminated in the US in 2000, but keeps coming back. Why? Incomplete vaccination. Some people refuse vaccines due to misinformation or personal belief. But herd immunity breaks down when vaccination rates fall, putting everyone at risk. Without herd immunity, even vaccinated people are vulnerable. The challenge of vaccine hesitancy. Vaccines have saved millions of lives, but fear and misinformation still threaten their success. False claims about autism, SIDS, and side effects, especially from a now retracted paper in 1998, caused drops in vaccine confidence. The result? Outbreaks in communities where people choose not to vaccinate. While most vaccines are safe, no vaccine is 100% risk-free, but the risk of the disease is far greater than the risk of the vaccine. Laws requiring school immunization have helped. Still, some states allow exemptions for personal or religious beliefs, creating gaps in protection. The role of herd immunity protects people who can't be vaccinated, like those with immune conditions or allergies. It works by stopping the chain of transmission. But for diseases like measles, over 90-95% of the population must be vaccinated to keep outbreaks from occurring. Conclusion: infectious diseases haven't been truly conquered, but we've made major progress. Using clean water and sanitation, antibiotics and vaccines, surveillance and quarantine, contact tracing and education, public health has dramatically reduced death and disability from infectious diseases. But complacency is dangerous. Vaccine resistance, global travel, and new pathogens mean we must stay vigilant. Smallpox was conquered, polio is close. Measles can be next, but only if we maintain trust, science, and public health action. Call to action. This presentation is based on Chapter 9 of Introduction to Public Health by Mary-Jane Schneider, 5th edition, published by Jones and Bartlett Learning. If you found this helpful, share it. And in the comments, tell us, which infectious disease do you think should be targeted for eradication next, and why?